Hello, Mouw Family Chiropractic. I'm Dr. Mark Mouw, and I'm going to come to you with a commonly asked question that patients ask quite frequently, and that is, are chiropractors bone doctors, pain doctors? What are you? Simple answer is we're nerve system doctors. I'm going to use the poster here to show you that. But once again, we need to understand that the brain controls everything in the body. The brain controls about 300 trillion functions in your body per second. But the brain needs to get the information to the body needs to get that information back up to the brain. And it does that through your nerve system. The first part to your nerve system off of your brain is your spinal cord. Now the spinal cord, I tell people, is simply an interstate of information coming to and from the brain. Where the interstate gets important are the exits. And we have 62 exits given off of our spinal cord. 31 given off on the right side and 31 given off on the left side. And guess where those 31 nerves go on each side? Everywhere in your body. But the important component to this is what's holding up the spine itself, and that are the 24 bones, or what we call vertebrae. When vertebrae are healthy, that means they move, they have function. They twist, turn, and have function and rotate. What happens though is when we live in a stressful life that most of us live in, right? Stresses come from all types of ways. Number one, accidents, falls, but people don't realize that sitting in a desk for 8 to 10 hours a day, which 65% of our population does, is actually a big stress to our spine, because when we have lack of motion, it literally causes misalignments called the subluxations, which I'll show you in just a second. But also we have physical, not only chemical, pills, drugs, medications we take, but also emotional stresses. And sometimes those are the worst because you can't get rid of emotional stresses, right? But literally a subluxation is when a vertebrae, one of these 24 vertebrae, move out of position. And what they do is they literally affect the nerve system. It's almost like a blow and breaker. So when a patient comes into us with headaches or digestive problems or low back issues or migraine headaches or sciatica, yes, they're coming in with symptoms, but symptoms literally are this. It's our body telling us that there is something wrong. It's kind of like the check engine soon light that goes on in our car. How many of you guys would put duct tape on that and just cover it up and hope that the car continues to run? No, what do? We go to a service station, plug it into a computer, and find out what's going on and actually fix and correct the problem. Your symptoms in your body are telling you there's something wrong. So we, as chiropractors, what we do is we look to detect that word in your spine called subluxation. Those subluxations are what cause your body to become unhealthy and not allow the body to heal at its best function. So when we make adjustments to the spine, there are mild movements, less than 1/8 of an inch, but literally it affects your nerve system and its overall function. So when we make the adjustment, not only does it express better health to your body, but it also helps you be healthier and heal faster. So if you have any questions about this, please post them. August, we're going to be answering questions that you have throughout the month. We'd love you to post. We'd love you to share if this is great information, especially with someone who needs care in our office. Once again, I'm Dr. Mark from Mouw Family Chiropractic. Until next time, thanks. Bye-bye.